Good afternoon, everyone. I can tell that the coffee was a little late. My name is Kellen Eilerts, and I'm the Regional Director for Human Network International. And I'd like to start today with just a quick thought experiment by introducing you to Georgette, a woman from rural Madagascar who has had limited schooling and only speaks the local language. Now, I want you to put on your behavior change communication caps, and let's ask ourselves, when does Georgette need reliable information on effective family planning methods? Or on how to protect her children from malaria? Or on where to find a trusted healthcare provider near her? The answer is that she needs this information when she needs it, and not just when it's made available to her. Now, I know this sounds rather obvious. Some of you are saying, okay, great. But the reality is that Georgette, like many women in the developing world, have limited options for answering their own questions at a moment of need. For example, the nearest clinic may be many kilometers away. Community health workers may not have the answer. And some questions, such as questions about birth control or HIV prevention, may be very embarrassing or even risky for her to ask, even when resources are available. Now, development sector organizations have long relied on traditional mass media channels such as radio, TV, billboards to answer these questions and promote healthy behaviors. We call these push methods of behavior change communication. They transmit a predetermined message at a predetermined time and place. These push methods do not allow Georgette to have any input on what information she receives or where and when she receives it. So how can we provide her with a pull channel to access her desired information at a time and place of her choosing? Now, all of us in this room have the best pull channel there currently is: the internet. So if we have an important question that needs answering, we simply open Google and pull this information with our nearest device. And I see some of you doing it quite effectively right now. Unfortunately, the cost of smartphones and wireless internet in much of the world remains high. 60% of the population in sub-Saharan Africa will still lack access to these channels by the end of the decade, and more than a third have literacy levels low enough that it poses an obstacle to using them at all. But what are available and already widely used by people like Georgette are simple mobile phones. So today, 88% of the African population lives under a cell signal. Of the 722 million mobile connections on the continent, more than 500 million are on simple mobile phones, so-called dumb phones, like this one, that you can find just about anywhere nowadays for as low as $10. So my question to you is, why is it that the Georgettes out there, who are already successful users of one of the most ubiquitous and revolutionary communication devices ever invented, can't use it to answer some of their most important questions? Well, for many years, behavior change communication on mobile has used a push approach, just like traditional mass media. SMS in particular has been the dumb phone equivalent of spam email, blasting out information that is frequently misdirected, contributes to message fatigue, and does a poor job of engaging people with low levels of literacy. But that's not using these devices to their full potential. Even these phones that some may call dumb can actually be quite smart and can provide people with a pull channel. So how do we use them to answer the specific need-to-know questions of motivated mobile phone users like Georgette? Well, in 2010, Human Network International created the 321 service, a mobile phone information service to help people in the developing world answer questions that are important to them. With 321, people use their own mobile phones to proactively pull this information as voice recordings or text messages in the local language, anytime, anywhere, free of charge. And it's available on all devices, from the dumbest to the smartest. So unlike push approaches, this interactive form of messaging allows the caller to be the decision maker. By dialing 321, they can listen and choose among hundreds of messages on topics such as education, nutrition, weather forecasts, and more. Each message is designed to be as easy to understand and as actionable as possible. And as all calls are completely anonymous, 321 provides a confidential means from which to obtain information on sensitive topics, including referrals to trusted local service providers. So since its introduction in 2010, more than 4 million people in Madagascar have made more than 50 million queries to the 321 service. Today, that's about 200,000 people making more than 1 million calls and texts every month. In Malawi, 25% of Airtel's total subscriber base used the service last year alone, making more than 30,000 calls per day. We're now launching the 321 service with telecom partners across Africa and Asia. By mid-2016, more than 100 million people around the world will have access to the service. And you'll notice there's a key country missing from this list, so if anyone from the ministry is here, we should talk afterwards. So what does this mean? While these are large numbers, they're only meaningful for behavior change if we can show how people are engaging with and acting upon the messages that they access. And this is where mobile truly outshines mass media. With mass media, you may have a rough idea of how many people have heard your broadcast, but you never really know how many people listened to, understood, and acted upon the key information you were trying to transmit. Mobile channels like 321 allow us to show results. We can track each call with real-time metadata track content usage with detailed metadata for each call, and we can even follow up with specific callers to evaluate their decision-making process and further actions. The beauty of this approach is that we can actually survey and continue to engage with our callers based on the specific messages that they listen to. So you may be thinking, okay, that sounds great, but who pays for it? 50 million calls and texts isn't exactly cheap. Well, our telecom partners cover the two greatest costs of providing the service: nationwide marketing and all subscriber airtime charges. And in Madagascar alone, that works out to an in-kind contribution of about $1 million per year from Airtel. And the reason the telecoms agree to do this is quite simple. It's good for their bottom line. We can show that people who use the 321 service remain more loyal to the telecom and spend more money on their other phone use. So we collectively have something of value to them, content that their subscribers want. Now, to develop the content, we form topic-specific content committees of NGO and government experts. These committees develop messages that are accurate, adapted to the local context, and aligned with national priorities. The end result of this public-private partnership is a trusted, sustainable, cost-effective intervention driven by user interests, provided for free, and delivered at scale without donor dependency. Now, I'm guessing that almost every one of you here today has a specific interest in understanding how to get important, life-enhancing information out to those who need it most. Mass media channels remain extremely important for some purposes, but are not effective for others. Mobile empowers disadvantaged populations to take action for their own benefit. And while smartphone and internet will one day play a much larger role in these situations, the reality is that millions of people will not have access to these devices, nor the necessary literacy levels to use them in their lifetime. So, what I hope you take away from this talk today is that we don't need to wait for these channels and skills to become commonplace, before we invest in simple, scalable solutions that are available today. We can already provide the Georgettes out there with the critical ability to pull the information they need when they need it with whatever device they already have. And 500 million dumb phones sounds like a smart place to start. Thank you very much.